In the initial parts of COVID, a lot of us were focused on people who were really sick in the hospital. We were worried about having enough ventilators. And at that time, we thought that, well, if you had a mild case and didn't need to go to the hospital, that people should just get better.
Most of the patients we see actually were never hospitalized for COVID. I do see a few here and there, but most of them actually had very mild to moderate COVID, where they just were at home and doing over-the-counter medications and things like that.
In order to go to bed, I literally had to crawl up the stairs. It was so all-consuming, the fatigue and the muscle weakness and everything, and you're just trying to get through life.
I think from a physiology aspect, long COVID isn't just one thing. It's lots of different things with similar overlap.
I'll be at a doctor's appointment and cannot remember 30 minutes later what we talked about. I have to take notes. So seeing Allie every month, it's repetition I've learned that helps me do things.
It's really figuring out how to connect with them on, okay, what can I do to help you? I'm here to help you, and validating that, yes, this is a thing that's happening to you. We understand it. We've seen thousands of patients at this point, so we believe you, and figuring out what are the symptoms that are important to you, and how can we best help with that, even if there's not a treatment for that symptom.
To be honest and upfront, it's a trial and error process. You know, sometimes you try something, it doesn't work, you try something else. I think that patients need to understand that we're not going to give up on them just because something didn't work, but also that this is complicated and we're all still sort of learning together.
I was in really bad shape when I came to the clinic, and now I have goals, I have hopes for the future, I have a management of myself and others to help me to keep that management.
We don't have, magic solutions, quick fixes for people, but the thing that we can assure them is that we're not going to abandon them and we'll walk through their journey with them.